The death toll in China from the COVID-19 virus has jumped by a record number in a single day. 254 new deaths have been reported over the past 24 hours, taking the number of fatalities nationwide to 1,367. The number of confirmed cases has also skyrocketed to nearly 60,000. And the reason for the surge is a change in the way authorities are confirming a diagnosis. So doctors will now rely on speedy CT scans of the chest to confirm a diagnosis. Well, Professor Steven Hoffman, Director of Global Strategy Lab, joins us live from Geneva. He's been attending a WHO coronavirus research meeting. Thank you very much, Professor Hoffman, for joining us. So, question is, why has China updated its testing method? What benefits does it bring? Will it actually provide greater accuracy?
Well, by updating its method, China is now trying to capture a broader swath of people. We know that there's been a backlog in diagnostic testing that relied on the RNA kits, so that's the genetic testing. But now in trying to look for symptoms, as well as with a CT scan to check for a chest infection, they're trying to capture more cases. That's the good news. The challenge, though, is that what could end up happening is people might not actually have this novel coronavirus. For example, if someone has the flu, they have flu-like symptoms, and if it's a bad case, they might have a chest infection, at which point we might end up having some patients being quarantined with folks who actually are with the coronavirus and then being susceptible to that risk. So it's on one hand, it's good. Hopefully we catch more cases, but on the other hand, there's some risks involved.
Professor Hoffman, in capturing this broader swathe of cases, then, is that directly related to what we've seen today in the surge of numbers of deaths and infections as well?
It is. It's directly related in the sense that there's a certain limited capacity right now in China to be able to do the genetic diagnostic test. If China only counted those that were using yesterday's definition, it would have been similar numbers of new cases today as yesterday. So in that respect, we're not seeing a huge uptick in the trend, but what this does confirm is that there's probably a lot more cases than we had known about up until now. Now, that's not so surprising. We've been saying that all along, that of course in an outbreak like this, no government can catch every case, but it is important that we're looking for as many cases and that we track the trajectory as much as possible.
So does this mean then other countries should follow suit in China's lead in changing the way they diagnose the potential cases?
Well, any country that has the diagnostic capacity to do the genetic testing should definitely stay with that. That's the best way to confirm whether someone actually has this virus versus whether someone has other symptoms or similar symptoms from a different virus. So, for example, in Singapore or in my home country of Canada, I would suspect that that will continue. But there's many places in the world that don't have the genetic testing ability. So for those countries, as we refine what exactly are the symptoms of this outbreak, and if we are able to use alternative methods when genetic testing is not possible, that would be a good development.
Professor Hoffman, as simply as you can you break down the difference between these two tests for us? Because we have been hearing that this RNA lab test, the nucleic acid testing, has been done up until now. Will it still be required, for example, since they're using these CT scans now?
I think it will, and it definitely should continue to be used, because that's really the only way at this point that we can know for sure whether someone actually has this novel coronavirus or whether someone has another kind of virus. And so if we only look at the symptoms and a CT scan for chest infection, which could be caused from a variety of viruses, we won't actually know whether that person has this virus or not. Now, a lot of the same treatments in terms of supportive care might be still appropriate, whether it's one virus or another, but sometimes that's not the case. And additionally, it would change the way that we might quarantine people and isolate them to make sure they don't spread. And so in that respect, the genetic test, the RNA test kits, are definitely the standard that everyone should be using when available. But when not available, this is an important part of being able to identify as many cases as possible. And right now in China, with such a backlog in the genetic testing, it makes sense to try to use symptoms and CT scans to guess as best as we can.
Professor Hoffman, you mentioned there with this new diagnostic methods, it will change the way people are quarantined, but will it also change how officials assess and track this epidemic, though?
Well, the most important thing in an outbreak like this is the trajectory of the cases. So the most important thing is how many more cases, or hopefully less cases, were there today as opposed to yesterday, and tomorrow as opposed to last week. And so in that respect, this news and the latest reports is a leveling off. It's the same number of cases that were reported the day before, if we are only focused on the genetic testing component. But what it does confirm is that there are probably a lot more cases out there than have been previously confirmed, which does then really solidify the seriousness in which the public health community around the world is taking this outbreak.
Well, thank you very much for your analysis, Professor. Professor Steven Hoffman, Director of Global Strategy Lab, speaking to us from Geneva.